Hi and welcome. My name is Tony Maritato. I'm a licensed physical therapist, and in this video, I want to talk about my 3-step process to help you best prepare for your upcoming total knee replacement. So step number 1, take a knee replacement class. They used to be offered live by the hospital, but now most of them have moved online. I'm actually recording and releasing my own version of a knee replacement course. This is a pre-surgery class that helps you learn everything you need to know to get ready for surgery and tells you what to expect in the rehab process after surgery. So whether you take my class free online or you take somebody else's class, take the time to take a knee replacement class because it really will provide you with a load of information that you probably didn't know beforehand. And some of it will just confirm things that you already kind of expected. Step number 2, have a physical therapist do an initial evaluation before surgery. Everybody knows that physical therapy is recommended after surgery, but what you might not know is that you can actually start physical therapy before surgery. I usually recommend 6 weeks before surgery. What we typically do, and I do this often, is if a patient is having a knee replacement surgery scheduled, I will do what's called a pre-surgical initial evaluation. We'll take measurements pre-surgery. I'll usually take some digital photos so I can see what the knee looks like before surgery, and then we'll be able to compare it to after surgery. We'll talk about all the things that need to be done before surgery, like getting your house in order, making a checklist of things that you're going to need to do during and after surgery. And then we'll create an exercise program specifically to help the muscles and the tendons around the knee joint. So the hip and the ankle are going to be doing most of the work while the knee recovers. If it's a right side knee replacement, the left lower extremity is going to be working a ton. And don't forget the upper body, the neck, shoulders, wrists, and elbows. You're most likely going to be using a walker, a cane, crutches, some sort of assisted device. So we need those other parts of your body to be as healthy and strong as possible. I know the first thought in someone's mind when they hear a pre-surgical physical therapy program is they think, my knee hurts so bad I can't do anything. But I guarantee a good therapist will help you work within your pain tolerance to improve the health and quality of the tissue around the knee and the rest of your body to give you the best chance of an optimal outcome. And I go with 6 weeks because 6 weeks gives your body enough time to change and to adapt. And if you're going to learn how to use a walker, crutches, cane, any assisted device, it's always better to learn before surgery and have time to practice than the day of surgery when you're groggy with anesthesia. So step number 1 was take a knee replacement class. Step number 2 was connect with a physical therapist and have a pre-surgical physical therapy evaluation done. And then step 3 is create your battle plan. This is a major event. Knee replacement surgery is a major surgery. There's lots of tissue damage, sometimes lots of bleeding. Your body is going to be 100% dedicated to recovery. And so because of that, you want to know beforehand who is going to do stuff like do the laundry, take out the trash, prepare meals, feed the puppies, right? These are all things that somebody is doing on a day-to-day basis. And so what I usually recommend to my clients is if you can take a little notepad and for a 2 or 3 day period, start to write down a list of every single thing that you do throughout the day. And then before surgery, hopefully a week or 2 before surgery, you can start to delegate out those responsibilities or plan ahead. A great little tip is a lot of people will cook meals ahead of time and then put them in the freezer so that they're ready to microwave and eat. Anything you can do, we want to hope for the best, but plan for the worst. And what that means is you want to be able to say, I think it's going to take me 2 weeks to recover and get back on my feet. Awesome. That'd be great. But what happens if it takes 12 weeks to recover and get back on your feet? You have to have a plan in place. And I can tell you that the more you plan, the more you look into the future, the less stressful the recovery will be, and therefore the better the outcome. So one more time, just to review 3 steps. Step number 1, take a pre-surgical class. Step number 2, connect with a great physical therapist and have a pre-surgical initial evaluation done. And step number 3, create your battle plan so that as much as possible you plan for everything that could go wrong, to go wrong, Murphy's Law, and during your recovery, you've got a solution for those things that come up. Guys, I hope this was helpful. If you have further questions, if you want to know more information, do me a favor, like the video, subscribe to the channel, and then post your questions in the comments below, because your questions help guide my video content. This video was an answer to someone's specific question. So guys, as always, thank you so much, and I'll catch you on the next video.